Good. Thank you very much. May I invite the board then to turn to item 6 on our agenda, which is the Corporate and NHS Performance Report, and invite Karen to kick us off.
Yes, thank you, Joe. I'm not going to say too much about the programmes beyond what is covered in the paper. I did want to just make the point that we are, as ever, keeping all of our programmes under close scrutiny to make sure that we are confident that they will deliver successfully for us. And as we are currently working on the way that we operate, we are looking at the extent to which those programmes can particularly help and support STPs and the transformation of the NHS, and make sure that we focus all programmes appropriately on that. I did, though, want to say a few words about primary care services, given the conversation that we have had at recent boards about the issues that have been created as a result of problems in primary care services since it was contracted out to Capita. I am pleased to be able to assure the board that we are, with Capita, making very significant progress on recovering and stabilising the services. There are still issues, and we are all working, and Capita are working hard to address those issues, so we're not completely where we need to be, but all of the individual services that are provided by Capita now have recovery plans, and we are confident that most of those services will be very largely recovered by the end of March, and indeed some of those services are already working at acceptable levels. The areas where we continue to have to do some more work and may take a bit longer to fully recover are in relation to the performers list, and ensuring that practitioners, especially those who are newly qualified, are fully on the performers list. But again, this is a very high priority for the work that we're doing and that Capita are doing to ensure that we do get all of our performers as quickly as possible onto the performers list, and we know that's a big concern for the GPs, for dentists and optometrists in particular. So I just really wanted to provide that level of assurance for the board, so that you could be confident that we will achieve a successful recovery in the very near future. And that's all I really wanted to say. I'm happy to now hand over to Matthew to talk about operational performance. Yeah, please do. Yep.
Any questions for Karen?
I think we just want to welcome that,
yes,
Karen, and to register our appreciation for all the work that's been done, and obviously focused on ameliorating the position for GPs, other health professionals, their colleagues and their patients who have been impacted by this. So it's very good to hear that that is going in the right direction.
Yes, thank you.
Thank you, Karen.
Thank you very much. Thank you. So usually on this board cycle I would now be talking about the November data, but as we published the December performance reports at 9:30 this morning, I'm going to talk about the position from December rather than what went out originally in the board papers, if that's okay with you. So December figures show that the A&E performance fell to 86% compliant with the 4-hour target in December, which is obviously some way below the 95% target and a long way below where we would hope to be. So there's considerable work that we need to do as we come out of winter to turn that round and put ourselves back in where we want to be. It's reflective of the high levels of demand on our emergency and urgent services, and particularly of pressure on beds within hospitals and the ability to admit. But I think I should start by just thanking the NHS staff who've worked so hard across the winter period, and I think have gone above and beyond the call of duty, as they always do when the service is under pressure, to try and ensure that patient care is as good as it possibly can. And Simon said it earlier, and I'd also like to put on record my thanks to them. We saw emergency admissions rise by 2.1% in December compared to December the year previously, compared to December 2015. Against that, it's also worth noting that A&E attendances per day fell for the fourth month running. So in December 2016, it was at 63,000 attendances per day was the average across December. If you go back to July, it was at 67,000 per day. So I think the message that we've been putting out to the public, that there are other ways of accessing urgent services, and that A&Es are for people who need an A&E, and you can go to your GP, you can go to an urgent care centre, you can ring 111, you can go to a minor injuries unit, has been heeded by the public, and I'm grateful to the public for that, because certainly that they have helped with the way that we've been able to handle December period, and also worth noting that the 666,000 people who used one of those urgent cares or walk-in centres or minor injuries unit, their turnaround time for being seen and treated and being able to leave was at 99%. So those services not only offer good quality services, but they are far more convenient for the public if they don't need to be in an A&E department. I'd also like to put on record my thanks to primary care GPs and their teams for the way that they've stepped up over the winter to help relieve pressure, both by GPs going in and working within A&E department and helping see and treat and turn patients around and get them the right care, but also by extending their hours to ensure that people could get access to the services that they need. And I think that is reflected in those in the very good performance for people who need urgent treatment and aren't looking to be admitted, because the real problem now is around patients who need to be admitted urgently to hospital, and at the back end of that, our ability to discharge patients back out of hospital beds. In December, we saw 195,000 bed days lost to delayed transfers of care. So that's over 6,000 NHS beds effectively that have got patients in them who ought to be more appropriately being cared for somewhere else. And that's an increase of 1,300 beds on the same position in December 2015. So imagine closing one of our largest hospitals. That's the impact on capacity that delayed transfers of care has had. And we saw in December a very small decrease in the number of those patients waiting because they needed an NHS service, but the number of patients waiting for social care packages or social care services is a third higher than it had been a year earlier. So we're really seeing what the impact that has on services. Despite all of those pressures, in the elective services, we've seen more admitted and non-admitted waiting list pathways completed in December 2016 than we did in 2015. And we've, as Simon said, seen an acceleration of operations. So more elective operations in the third quarter, so October, November and December of 2016 than we did in the first quarter, April, May, June of 2016. So we are still seeing a growth in the amount of waiting list activity, and because of that, we've only seen a very small reduction in performance around the 18-week target. So that fell to 89.7% against the 92% target of patients who should, for people should just remember, we're saying within 18 weeks from seeing your GP, being referred into hospital, being seen in outpatients, having all of your diagnostic tests, and then receiving your treatment, we're saying that should happen in 18 weeks. And for nearly 90% of patients, that does happen. And that is world-class access by any standards. So I think it is impressive that we, under all of this pressure, that we are still seeing that work go on. I'd also just lastly draw your attention to cancer performance, where we continue to hit 7 of the 8 performance standards for cancer, and we are just below the 85% standard for patients starting their treatment within 62 days. So we need to do that last 2% push to get ourselves over the target, but performance is still good. So I should conclude by reiterating my thanks to staff across the board. It is extremely pressured out there. You can watch it on the telly, or you can go and visit a hospital. You can feel just how busy it is and the extent to which we're keeping the show on the road, and our staff are working to do that. It is fantastic. And I would just like to throw across to Jane here as a Chief Nursing Officer, just to say something about the cold weather alert that's just gone out, and what people can do to help themselves and help their families and help their neighbours. If you would, Jane. Thank you.
Thanks, Matthew. And I just want to reiterate, I have spent quite a lot of time actually out in the system. So I visited communities, I've been in A&E departments, I've been talking to staff actually delivering services at the front line and in the community, and it is very pressurised, and they are working extremely hard, but still providing, in the vast majority of cases, extremely good care. But alongside that, with all of those pressures, we have just had a cold weather alert that many people will be aware of. So the weather for this weekend until Monday is very cold. We know that cold weather has a negative impact on people's health, particularly those that are elderly, frail, have other conditions. So if you have, you get an increase in heart attacks, strokes, respiratory disease, etc. So actually looking after yourself during cold weather and helping relatives and neighbours is really important. So there is well-known advice, which is try and keep your house or where you live warm to about 18 degrees. Make sure that you eat regularly, plenty of hot drinks, hot fluids, that you dress in multiple layers of clothing, that you stock up with drugs and food, and neighbours can actually help and keep an eye on local people, particularly those that are more vulnerable and elderly. And so I think that's really important, just to try and help manage what we know is always an impact in the health service, and actually enable people to stay as well as possible. It's a really, really important message. And some of the things that people often say is, well, fuel's really expensive, and it is, but there are services and systems out there, winter fuel payments, cold weather payments, warm house discounts, that actually people can access, and encourage people to really do that and to make sure that families and friends know about that. So thanks, Matthew, for asking me to speak.
Thank you, Jane. Any questions or comments for Matthew? No, well, I think we received the report. I mean, we will understand that continuing to drive improvement in urgent and emergency care will be one of the key things that will occupy our attention over the coming year, will be a key point, I'm assuming, of the delivery plan, business plan. And we will come back to see how quickly the NHS in England can get itself back up to the target objectives. Good.